My name is Heikki Nikkanen. I'm an attending physician at Brigham and Women's in the Department of Emergency Medicine and a toxicologist both at Brigham and Women's Hospital and at Children's Hospital. I'm also an instructor in medicine at Harvard Medical School. I have no conflicts or disclosures related to this lecture. Today we're going to be talking about a number of different toxic ingestions, ranging from over-the-counter medications to toxic alcohols, some common drugs of abuse, and then finishing up by talking about mushrooms, plants, and some herbal medications. No discussion about over-the-counter medications would be complete without talking about acetaminophen. It's a pretty ubiquitous medication. It's an ingredient in a large number of over-the-counter and prescription preparations. It's one of the most common agents in suicide, at least in the United States, and it's also the leading cause of acute liver failure, both from intentional and unintentional ingestions. Acetaminophen is very rapidly absorbed through the small intestine in a very predictable manner, except for a few important exceptions of cases where co-ingestants are involved. The distribution is fairly small, the volume of distribution being about 1 liter per kilo, and it's not very highly protein bound. So if you needed to dialyze it off, that's possible. Metabolism of acetaminophen is primarily through glucuronidation and sulfation, which account for about 90% of the metabolism to a non-toxic metabolite form. But to a lesser extent, a small amount is metabolized to a toxic metabolite known by its acronym NAPK. This occurs through the CYP450 system. The clinical presentation of a patient who's taken an acetaminophen overdose can range from asymptomatic to somebody who's got a very severe encephalopathy and liver failure, depending on when you see the patient. For the first few hours, there may be no symptoms whatsoever, and subsequently, nausea and vomiting may develop. Over the next day or so, right upper quadrant pain, as well as elevation of the LFTs can be evident, and then finally encephalopathy and coagulopathy developing in the period from 36 hours to 120 hours after ingestion. Patients who survive this period typically have a full recovery. When evaluating a patient who has ingested acetaminophen, it's important to divide the cases between an acute ingestion of acetaminophen only and then all other cases. The recommended daily dose of acetaminophen on the package inserts is about 4 grams in adults or 75 milligrams per kilo in children. But as little as 150 milligrams per kilo in a single dose can cause hepatotoxicity. If you know the time of ingestion and you know that it was an acetaminophen-only ingestion, you can use the Rumack-Matthew nomogram to predict toxicity. However, in cases where the time of ingestion is not clear, when the overdose is chronic, or when the overdose involves a co-ingestant, these are much more difficult to assess. And so those cases you have to treat presumptively